Morning, everyone. I'd like to call the Personnel Administration and Higher Education Committee, October 29th to order. First order of business is a motion to approve the minutes from a prior committee meeting. Motion by Supervisor Etu, Supervisor Driscoll on the second. Any comments? Recommended changes? Seeing none, I'll call the question. All those in favor say aye.
Aye. Aye.
Any opposed? That carries. Privilege of the floor. Seeing none, move forward to SUNY Adirondack. We're not here today again this morning. Action item 2, request to be discussed by the Human Resources Director. Jackie, any comment on the tracking of vacancies filled? No comment? Any questions? Seeing none, move over to 2B, Matt Shewitt, representing Marshall and Sterling. Morning, Matt.
Morning. Morning, all. Doing well. So the purpose of me being here today is that, and I guess I'll back up. Normally, we go through and we're handling your healthcare for your active employees and your retirees at the same time in late August, early September. And the timelines have changed a little bit now that we have Anthem. They run on slightly different timelines. So that's why I'm here today specifically to speak about your Medicare retirees. And just to make sure we draw the line, this is just for your retirees who are on Medicare. You have somebody else who's 58 or 62 who's retired. They're on your other plan. They're on Highmark and what's going to be ProAct here shortly. But so we're just speaking about Medicare retirees. And I always think it's a good time just to kind of give you a little bit of a, and I won't take long, I promise, but give you a little bit of a history of how we got here. So when we first came on the scene, this is, 8 years ago or so, you had 2 carriers for your retirees, your 65 plus retirees, your Medicare. One of them was Empire at the time, it was now Anthem, and you had CDP-HP. We moved to Humana, and I'm refreshing this for a reason, because Humana was just, we saved a tremendous amount of money at the time, moving to Humana, and they were fabulous for many, many years. Great job in service, great job with rates. Enter through that late last year into 23, going into 24. You may all recall Humana had a major provider disruption problem. Albany Med was going to be out of the system, out of their network, meaning Glens Falls Hospital would have been out. And that's all still true. So we moved at that time to, in March, just back in March of this year, 24, to Anthem. And obviously, had everybody in a meeting, all the retirees, and it's gone really, really well so far. The plan does renew in January, which is what we have to discuss. So what you have in front of you, if you want to shortcut the kit a little bit, and even just, you can skip to the back and I'll show you what we've done. The very last page. If you want to write something down, which I think probably should have been on here, is the Humana rate when we left Humana. So we left for one reason again, and it was because of the provider disruption. We had certain oncologists that weren't going to be in, we had hospitals that were in, but the Humana rate when we left was $206.22. So that's what they were charging as of January 24, and in February 24. In March, we moved over to Anthem. So this is what you're looking at in front of you now with as far as the plan. On the left-hand side, we got a nice little rate reduction from Anthem at the time. We didn't even need it necessarily, but it did help the budget in 24. But they went from what was a Humana rate of $206 roughly down to $149. And then in the meantime, what's happened in the background, there's been some changes to the regulations with CMS, limiting the out-of-pocket exposure, and also changing what they reimburse, what CMS reimburses to the insurance carriers. So you can see it on there on the bottom in red, what the max amount of pocket used to be around $8,000 in total. the CMS, the rules have changed where they brought that down to 2,000. So it's been an improvement to the plan, mandated improvement to the plan. And at the same time, again, you just have regular healthcare inflation and cuts on what the care, what CMS is essentially providing back to the insurance companies to manage the Medicare piece. So we have I guess I'm just gonna call it a little bit of a budgetary, yo-yo, for lack of a better phrase, where it was at 206, it was 149 for 9 months or so, and it's bumping back up, and you can see on the revised renewal to the right at 208. So when you're looking at a year to year, it's a less than $2 change in the rate, but it's, obviously it just roller coaster a little bit. It went down, which is a good thing, and it's spiking back up to the 208. So it's pretty steady overall if you look at it from 12 months to 12 months. Now, of course, if you turn back a page in here, the rest of it I just skipped over because you already know who I am and who Marshall and Sterling is. But if you go skip back a page, then these are we of course went out to market. You would be inclined to not want to change since you just did it in March, obviously out of necessity. But, it doesn't mean we're not going to look at other options. So of course we go out to Aetna, CDPHB and Highmark and MVP and Hartford and all of them that are out there. And nobody's even close to what most of them, when they say uncompetitive rates, or meaning they just decline to quote knowing they can't be competitive. And that often happens. So I think even you'd be inclined to stay because again, you just changed in March. There's no real financial reason to change. And it's seemingly, Jackie from HR, Empire's Anthem's been doing a decent job from what we understand. Members have been reasonably happy. So I think from a service side, they're doing what they said they're going to do. And from a rate side, they're back to where you were earlier. I think it should stabilize from here because this year took into account a fair amount of those legislative changes. But I'm realizing that I'm just talking too much now. So questions?
Questions from the committee?
Thank you, Mr. Chairman. Matt, how does was it $900,000 increase due to the weight loss prescriptions that employees have been using? How does that factor into this? Less retirees probably use those, I would assume. But...
Two different buckets. So that doesn't factor at all into this. Okay, that is purely, that was on the, for your active population through Highmark and Proact.
Right, please.
How does PROACT affect this, or does it?
Does not. Yep. Yep, so two completely different buckets. So this is just Anthem entirely, and you're gonna be really with, primarily with this in the future, just one carrier. We won't be able to split and do some of all those cost containment things that we were able to do on the other side. So from Humana to Anthem, Anthem manages all of it in the background. No Highmark, no PROACT. Your claims overall do affect the utilization, but not like they do on the other side. Right? You're not self-insured.
So looking at the agenda paperwork, I guess we need a motion to renew the Medicare Advantage coverage effective January 21st or 25th or January 1st, sorry, 2025 for Warren County retirees. Ben, for the first, we have a second. Supervisor Thomas, thank you. Any questions? Call the question. All those in favor say aye.
Aye.
Any opposed? Oh,
I'm
sorry.
not opposed. I'm just saying, should I recuse myself being a retiree?
Barry, any comment?
And I didn't think of that until.
It's probably best, just to avoid any appearance.
We have one recusal.
Yes,
It passes.
I wasn't thinking. And
Thank you, Matt.
Okay,
I guess
thank
we're
you
all
all.
set. Thanks again.
Sure.
2C, request to adopt the revisions to the Warren County out-of-unit employee benefits policy. Question for Jackie. Jackie, is this just bringing our out-of-unit employees in line with the union contract?
No,
Okay,
those are the primary changes, but because this resolution is a compilation of many resolutions from the eighties through today. Larry was kind enough to go through the entire thing, so you'll see there are just some kind of editorial changes where things didn't make sense, or the compilation of the various pieces all together didn't read so well. So the substantive changes are to keep with the CSEA contract, allowing out-of-unit folks to take time off in half-hour increments. We're changing the contribution percentage to match the CSEA rates. And then the sick leave payout has been modified as a result of rescinding local law 4/2008, which is a pending change in the background as well. So we're updating this to keep it consistent with those other moving parts, and then a few sort of editorial ease of reading changes.
Motion to bring this to the floor?
If I could, before it comes to
Of
the
course.
floor, there would just be one change, which is on page 9. The red line version, paragraph 10 and 11. It has the date of November 15, 2024 as the effective date. That should read November 30th of 2024 for both paragraph 10 and 11 under sick leave. Because that would be the effective date for the revocation of the local law 4/2008, which provided. And then the second is on page 13. Under health insurance coverage during retirement, paragraph 3. There is a blank in that paragraph. And that is in order to determine or to provide when a retiree who does not initially elect to take coverage may be permitted at a future time to enroll. Meaning is that, would that retiree be able to enroll during open enrollment, any day of the year? The question's important because we would want to maybe avoid gamesmanship where someone gets a diagnosis and then decides, hey, it's a good time to start paying for insurance tomorrow. So I'm not sure, because there was no date provided previously or time period for when a retiree who seeks after retirement to engage back in health insurance would be permitted to do so.
I think in the past, we've allowed them to enroll on the first of any month, as they're usually enrolling because they're losing other coverage, provided that they have the 20 years of service. But we did not make them wait until open enrollment.
I'll add it as first of any month for that blank. And then as the committee may wish to discuss that, if there's questions about it.
Any comments? One of the things that I can think of, Larry, is typically you can change if you lose your current policy, current health insurance. You can move into some type of other insurance. Would this be something that would be an effective way to do this? Dr. Davis,
I would, I can't answer the gamesmanship piece of it. I just needed to know when individuals would be, I didn't know historically what we have been provided. I was aware of that potential concern.
Any thoughts from the committee?
Can you say that again?
Well, I thought it would be the first of the month after if they lost current coverage. Not just switch from one insurance company to another.
So would that stop them at any point? You know, some people might have reasons to switch. You're trying to stop them from going back and forth type,
Well, it's kind of the thought,
Can't you only
what we
do that
mentioned.
Is that practice?
Well, that's the question. This is for retirees, not for employees. And my understanding is that the past practice then would be the first of any month a retiree could opt into coverage.
I'm open either way. Consensus of the committee?
I would be inclined to say the first of the month. To stick with that. So that people
Any other
have
thoughts?
coverage.
Make a revision to this, right?
I just so I'm clear, so if an individual retires on the 15th of the month, do they have coverage during that 2-week period?
Sure, you're covered through the end of the month in which your employment ends.
Okay, all
For
right,
any
okay.
reason.
Okay,
This piece speaks to retirees who elected not to continue as a retiree. So if
Okay.
somebody retires and goes on their spouse's coverage for 5 years, 10 years, and then their spouse loses coverage for some reason, this allows a person with 20 years of service at Warren County to elect to come back into our plan. I've only seen it a handful of times in my 10 years that I've been here. And I believe in every instance, it has been because somebody's, their spouse is then retired or lost their coverage. I don't think I've seen any other reason for that, or they get divorced or something like that and they lose their coverage. So it just is like a safety net clause for people who don't take retiree benefits, but then come back later and go, oops, I probably should have done that.
Consensus of the committee? What Larry's original was, first of the month. Okay,
Thank you for letting me make that change before.
sure. So that was before the motion, so we don't have to do anything other than bring the motion to the floor. Vice Riti, Vice Mayday, any questions, comments? Seeing none, I'll call the question. All those in favor say aye.
aye,
Any opposed? That motion carries. Moving on to criminal justice, a request from the sheriff's organization for a new position of patrol sergeant number 11-C. A contingent position, annual salary $66,111, effective January 1st, 25 to March 31st, 2025. Motions, Rising Me Too, Superintendent Mayday. Any questions, comments? Do you know, Frank?
What's the purpose of it looks like a 3-month?
Go ahead.
Thank you, Mr. Chair. Basically, if the discussion in criminal justice was one of the patrol lieutenants is going to retire. They've identified a replacement internally, who's currently a sergeant, to replace that lieutenant. They want to create this position to move the sergeant into a position where, so he can basically shadow the patrol lieutenant before he retires in the spring. So this is just a contingent position. The person will be in it until the patrol lieutenant retires. He'll go into that position and this position gets eliminated. And they have the money in their pay budget to cover it, the salary budget.
Any other questions? I'll call the question about this resolution. All those in favor say aye.
aye,
Any opposed? That motion carries. Moving on to item 4. Request of items to be discussed by the county administrator. 4A is adopting amended department head evaluation policy and related forms. Would you mind helping?
Thank you, Mr. Chair. These are A and B. For A and B are two. We're going to rescind 2 resolutions. The first one was passed in 2019, and it required performance evaluations to be done on department heads. So basically, we have 850 employees, 650 of those are full-time. 500 of those employees are union and do not, in all their contracts, do not have performance evaluation. So this basically applied to, and it didn't apply to all the outer units, it only applied to 21 of 29 department heads. And after a couple of years of implementation, it became inflated. And post-pandemic now, according to the Society of Human Resource Management, only about 12% of corporations are doing performance evaluations of these type anymore. So we have begun I meet with the department heads. The elected have volunteered to participate as well. We do check-ins and we talk about goals and we talk about performance and things like that. And that's currently the trend. So we just like to continue that and not, and so this is basically housekeeping. We haven't been following this for several years now. That's the first one. The second one is, in 2022, we passed a resolution requiring diversity, equality, and DEI training for employees. And we spent several months, after I got here, I spent several months because it was brought to my attention, we were supposed to do DEI training, trying to identify a training program that would fit the diverse organizations that we have across the county and the county workforce, and we really couldn't find anything that would fit our needs. I'll be honest, DEI training is also a downward trend right now. But we recently approved leadership training, and we're going to incorporate diversity training for leaders in that. And I'll work with the department heads and supervisors to model good behaviors that will carry on to their employees. So we'd like to rescind both of these.
So without objection, can we bring both of these together? Seal? So I need a motion to bring for A and B. For Supervisor Mayday, Supervisor Merlino on the second. Any questions or comments? Seeing none, I'll call the question on these resolutions. All those in favor say aye.
Aye.
Any opposed? That motion carries. Moving on to number 5, request discussed by the county attorney. Larry, I'm going to turn this over to you if you don't mind.
Thank you. The first request is to approve settlement terms in the matter of Michael Davis versus Cole Porter, Town of Queensberry and Warren County. And we're looking for authorization to settle claims and pay the amount of $7,500, which is less than the self-insured retention amount for the insurance coverage for that matter. The Town of Queensberry is also contributing a like amount of $7,500 for this settlement. And that's the request.
Motion to bring this to the floor. Supervisor Ritu. Supervisor Driscoll on the second. Any questions or comments?
Can you remind me what happened? I know now it's a 4-stop sign, 4-way stop. It used to be 2. Did somebody go through it right after the signs were installed or something?
No, before the signs were installed, the weekend before the signs were installed, a motorcyclist was driving northbound on West Mountain Road. As he approached Laverne Road, the defendants, Palmer's, appeared to have stopped at the stop sign and then proceeded to do a left-hand turn in front of the oncoming motorcyclist. That's the basic facts. And then the scheduled installation of the stop signs occurred during that following week.
And it's a county road. But what
West Mountain Road is the county road and Luzerne Road is the town road. So to settle all claims, both municipalities are seeking to agree to pay $7,500 rather than continue with any further litigation.
what was the claim against the county?
Negligence. I can go into more in executive session if you'd like. In fact, I'll add the case to my request for executive session after the resolution requests. If you think you need more information. we can
It's a
take-
low dollar amount. I just,
Any other questions or comments? Call the question on the motion. All those in favor say aye.
Aye.
Any opposed? That motion carries. 5B.
As you can. My office is working through a number of different county policies to update them and kind of conform them to current existing New York State law. And this is one for this committee, which is the county discrimination and harassment policy. What we did, and the reason you don't have a red line version is because we went back to the Department of Labor's proposed policy for municipalities and tweaked it for Warren County. So what you see and what's been provided in your packets is in line with what New York State Department of Labor recommends municipalities enact for a policy regarding workplace harassment. I'll stop there unless there's any questions, but my recommendation is that we follow the state recommended policy for Warren County as it's provided by the attached document.
Motion to bring this to the floor. Supervisor Ito, a second by Supervisor Mayday. Thank you. Any questions, comments? Seeing none, I'll call the question. All those in favor say aye.
Aye.
Any opposed? The motion carries. On to discussion items.
Well, for a litigation update, I'd request a motion to enter into executive session under the Public Officers Law 105 from paragraph 1D to engage in discussions of potential pending and current litigation, and also to provide some attorney-client communications to the members of this committee concerning the following litigation matters that are below. Number 4, which is Michael Davis versus Cole Palmer and Nicole Palmer. Number 5, Jasmine Ernest versus the Town of Queensberry. I believe I'll limit my executive discussions to those 2 matters.
Motion to bring this to the floor. Supervisor Ito on the first, Supervisor Driscoll on the second. All those in favor say aye.
Aye.
Any opposed? We will enter an executive session.